With HIV, very often, in fact, the majority of the time, people won't have any symptoms. And so that's why it's so important to get tested as part of a regular checkup, really at least once for every adult, and for those at higher risk or with new sexual partners, more frequently than that. When someone's diagnosed based on a blood test, we actually have a team of social workers and other support folks who meet with that person, answer any questions they have about their diagnosis, help to make sure they have access to an HIV care doctor, help to make sure that they have access to treatment unfettered by any cost limitations. We know that in Santa Clara County, LGBTQ populations are disproportionately impacted by HIV. So this portion of our community is one of the groups we want to make sure have the best access to testing and other prevention tools. One of the most important things we do to prevent new cases, to make sure that people living in our community with HIV have access to their medication. The reason for that is that when somebody with HIV takes HIV medicine every day until their blood level of virus is so low we can't find it on a test, they're called undetectable. And at that level, they actually cannot transmit HIV through sex. The County of Santa Clara actually does better than most national metrics in how we take care of people living with HIV and prevent people living with HIV. Also in Santa Clara County, we do a really excellent job of making sure people living with HIV get linked to an HIV care doctor and to the medicine they need very quickly, which helps improve their health not just right away, but for the rest of their lives. For people who don't right now have access to affordable medications, one of the most important things the county does is fund the STD clinic to actually pay for the cost of medications, as well as all of the medical care that it takes to support someone in seeing a doctor and starting the medicine.
We have a lot of tools that we didn't have at the beginning of the epidemic, and they have made a difference. The challenge for us moving forward is to stay on it until we reach our goal, which is, as others will tell you, 0 new HIV infections, 0 AIDS death, and 0 stigma.